So, Dr. Aimee, thank you so much for joining me on the Fempower Health podcast. I know a mentor of mine works very closely with you and has spoken highly of you. And I've actually been following you for a while, given my 4-year fertility journey. And I really wanted to have you on today to talk about the latest and greatest in the world of fertility. But before we dive in, I wanted to give you an opportunity to introduce yourself for those who may not know the great work you're doing, and then we can dive in.
Thank you, Georgie, for giving me this opportunity to talk to you. I'm truly honored to be here. So basically, I'm a fertility doctor that's way too passionate about something, and that's making sure patients are fertility wise. So that's my new thing. Like I just say it over and over. Please get your fertility wisdom before you start your treatment. Figure out what's going on. Diagnosis before treatment. That's been my mantra from day one, and I'm always trying to perfect how I communicate with people so more people can hear this message and really understand it and take that to their doctors. Here in San Francisco, I'm at the same basically desk in the same office since 2008. I absolutely love what I'm doing. And the day I take a day off is the day that I'm in a grave. And don't worry, I have no plans of doing that anytime soon, but that just shows you how extreme I am and in terms of like how I work and what I do. I also have a podcast. I've been podcasting, and I have IVF classes. I have a show called the Egg Whisperer Show. So even if someone out there listens and hears what I have to say, they don't have to come and see me as a patient. They can also learn from what my approach is in a number of different ways. So I hope that, the things that I do can help someone out there, even if it's just one person a day. Like I feel like mission is accomplished.
Right. And it's so interesting to hear you saying this because, I started my journey in 2010. I'll have to tell you what that was, but just the setup here is that the education is still so needed because, in my view, and again, I'm so connected into the women's health space because I'm constantly talking to the experts. It's still surprising to me that we are. I mean, obviously, fertility is a whole different world, but I feel like just the knowledge we still need to have about our bodies, and then you add to it understanding fertility. I'm curious what your thoughts are on that. Like, are you finding that even with all the social media and whatnot, that we're still just finding these gaps in understanding our body in the world of fertility, obviously?
Yeah, I mean, I think with social media, it's helping people feel less alone.
Yeah.
And so that's a huge win. I think younger people are getting the message that the older women are just like pissed that no one talked to them about their fertility. And,
Yeah.
you know, like no one should be surprised that at age 40 you're going into menopause and you can't get pregnant with your own eggs. That should not be surprising to anybody. And so I feel like all those 40-year-olds are like screaming at the top of their lungs. So women now are actually freezing eggs at a younger age. So when I started egg freezing party back in 2014, I started throwing these parties all over the country and world. What happened is the women would wait until their fertility levels were abnormal and then they would freeze their eggs. So they're basically freezing a lot of bad eggs, but you should really do it when you're younger. And so I think with social media, people like that message is out now, like freeze eggs when you're younger, you're better off. But the disservice that social media is doing for our patients is, you have these celebrities that aren't being honest about how they actually are getting pregnant and they're misleading people. So I still have these conversations with women in their late 40s, like 47 to 49. And they're like, I'm amazing. I work out every day. I do hot yoga. And I'm like, and you still need an egg donor. And they just like, but I look so good. And I'm like, that's amazing. Your ovaries just don't know how amazing you look. It's not like you can put Botox in your ovaries. There's just no such thing as that. And so I feel like it would be nice if people could be a little bit more honest about their pregnancy journey when they're at an age where the chances are truly zero. I mean, you're going to have like 1 out of 2 million that can do it between 45
Right.
and 50, but there's no amount of like, attracting it to yourself and like believing in it that's going to help. There's no amount of healthy eating that's going to make
Right.
your 47-year-old eggs 27. One day I hope that there's going to be a shift, and people are going to focus more energy and research into helping us have babies and I don't like to use the word older age because I'm 47. I feel super young. I feel like I could totally have a baby right now and get pregnant, but my ovaries is a different story.
Right.
But we haven't, and I'm sure we're going to talk about this stuff
Yes.
soon, right now on the show.
Yes.
So I'm not going to tease.
Yes.
I'm going to just tease that a little bit.
Yeah, don't give it all away yet. So, I guess for those who don't know my story, I do want to at least give that as context. So, in 2010, I had just gotten married, and I've often wondered what would have happened if this exact thing did not occur next. So I was the person where, my grandmother had 14 kids. I was 35-ish when I got married. I had always been on birth control. And, as with many, it's like, okay, I'm married now. Now I'm ready to start my family. So I was, trying to time it of when I would start trying, et cetera, because I come from this fertile family. Everything's going to be planned. I happened to go to my OBGYN, and she happened to be very proactive. She asked me all these questions. Are you trying to have kids? Asked me all this background. She goes, you know what, just to be safe, why don't we just do a workup? I had no idea what was going on because, again, in my mind, get married, have kids. It's what my family did. No one ever had problems. So she calls me the next day and she says, you need to go to a fertility doctor. And I'm like, what? Like, what's that? What? And I have a background in healthcare. I've been a consultant. I've worked for biopharma. Like, I can do medical speak. I used to sell to doctors. Like, I got it down. And even this was a ride. Like, my first I have to give a couple of examples too, just for women to see like the craziness sometimes that happens. So one, I had no idea what was going on. And my first appointment was this lovely doctor and I was in New York City. So I had all the top centers, access to them. And he gave us the whole spiel of everything, prepping us. And I go in for this thing I had no idea that I was doing, the transvaginal ultrasound and all the blood work. I go in, I lay down, and this doctor I've never met before, he was not the guy that I spent an hour with educating me on all this stuff. He runs in, doesn't even say hello, just sticks the thing in and says, okay, there was like a whole conversation. And now like, I don't even know you. And you stuck this thing in me. And now what? And so I left, called my OBGYN. And this was basically one of the top centers. And they probably could have actually helped me get pregnant, but I left. So I called my OBGYN and I said, I need someone who will like actually talk to me. So then she sent me to probably the worst doctor that is in the industry, who was probably using insurance to be able to cover the treatments he was giving me. And because I was desperate and had no clue and was naive about what was ahead of me, I stayed for like a year or so. And even his nurses were like, it's time to move on. So then I kept hunting. I went to one guy. This is back, I hate to say back when, but technology's advanced so fast. I had, this was before the apps on period tracking. So I had the paper and I had my acupuncturist and I had everything. I read, taking charge of your fertility. I had it down. I go in with my paper charts. You know what he says to me?
What?
I don't need to see this. And I was like, you're fired. I walked out and never went back to that entire academic medical center.
Yeah.
And on and on. And it was the 10th doctor, Dr. Jeffrey Braverman, who's since passed away, which was absolutely tragic, who figured it out that I had endo but I did everything in between, the acupuncture, the vitamins, the this, the that, and the hope and the maybe this. And so what I love is you started with, guys, if you're at this age, like, because I think people do promise these miracles. And I think there's just certain facts out there. And I remember that journey, that 1% of hope. It's like if someone said, stand on your head, I'd be like, all right, I've been at this 4 years. If that's what I need to do, I will do it. And so it's just this crazy, stressful ride. And that's why I wanted to talk to you, because I know you're so passionate about the education piece and helping people truly understand what's out there. So again, my journey was a long time ago, but I guess first I'll let you react and then, we can talk about other aspects.
Yeah, I mean, you didn't really share like the happy ending of your
I
journey. I
do have, oh, I
imagine
have an
there was.
8-year-old son. Yeah, I have an 8-year-old
I
son.
love that. I love that. And I think what you show to, people who are listening, that you just leave no stone unturned. You keep asking questions and you just don't take no for an answer. And then, not everyone has eggs that, are healthy enough to turn into a healthy pregnancy. But I tell women it's very realistic to go through 4, 5, 6 cycles to even have a healthy embryo for some people. Like, I don't want people to feel like they're an alien or there's something abnormal about them.
Right,
That can sometimes be a normal human experience for people who are struggling to conceive.
right.
So, that's how I would react to that, is that, take your story as a lesson that it can take some time to find that golden egg, so to speak.
Yeah, no, absolutely. Now, since you brought up egg freezing, um, I do want to talk about this because I know that um, there were a lot of companies that were really like, let everyone freeze your eggs. And it was right when I guess it was the ASRM had said, yes, women who are not trying to, are going through cancer treatments, et cetera. Yes, anyone can now freeze their eggs. Um, so I would love to get your thoughts on what women should be aware of, because I find with the press and social media, everyone is like vying for followers and the shock, right? And I think it's important to talk about the facts, because I will say when the whole egg freezing spree started, I would go into listening to their seminars. And I already had my son and I knew that I couldn't have any more kids. And I just went, I was like, I want to see what is happening. And it was very scary, the pressure. And, then I felt like I had to say everyone, but it doesn't guarantee a baby. So I felt like I was the one constantly giving that message. So, what is the fair, balanced way to look at egg freezing so that people are like, do I do it? What are the risks? What could the outcome be? Like the facts, not the I want clicks on social media.
Yeah. So what I tell people is that the only thing that egg freezing ensures, there's only one thing, and that ensures that you'll have another chance in the future at an older age that might be better than the chance that you have at that age. That's it. It's just another chance. And then the other thing I tell people is, there's this concept that you can freeze your biological clock. And I hear that over and over: freeze your biological clock and freeze your eggs. I'm like, that's also a bunch of bullshit too, because you might be freezing your eggs, but what can still grow are fibroids, endometriosis, polyps. Sperm could be bad. So I feel like people don't realize that the longer you wait, the higher the chance that you actually will not have a strong enough uterus to carry a pregnancy for yourself. So really, become fertility wise when you start your egg freezing journey, so that you're not waiting too long. And then if you're going to wait, at an age where you can't go back and freeze more eggs. Let's say you're going to use your eggs at 46 when you froze at 36. Really be open to other ways of having a baby, and think about those now. Like, don't wait till you're 46, thaw your eggs, and find out none of them were healthy, and then feel like disillusioned and angry that, someone misled you. You should have heard our conversation, and then you say, oh yeah, I heard this and I knew that ahead of time, that, you can't have it all. You can't freeze your biological clock. It's not, entirely possible for everybody. And freezing your eggs just gives me a better chance at 46. And what I don't want anyone to say is, and I wish I had frozen more eggs had I known that. So that's my other thing that I always tell people, because I want to prevent regret, is freeze more. So if you're going to delay childbearing to an age where you're in menopause, or, in perimenopause, which is, for some people over 35, for others, it's usually around 40, freeze more eggs while you still have them. And then also consider making embryos. So just to give you a chance to have a baby with your own DNA, if that's something that's important to you. So I have patients who will, let's say, do, a couple cycles of eggs and then one cycle of embryos, and they truly, want it all. They want the dream wedding. They, that's something that's really important to them. For me, wanting it all doesn't include the dream wedding. But that's just, for some people it does. And I totally respect that. So, I think those are the things that I've learned through my experiences with patients who've gone through egg freezing. And I hope that people who are listening to this can learn from that. And then if they, follow this type of approach, then they won't be burned later on when they're ready to use their eggs.
Right. And I guess then let's talk about the nuances, right? Because I remember that anxiety where, you know, looking back now that I've interviewed, over 100 experts on all these women's health topics, now that I have my child, now that I've hit menopause, and there is absolutely no way that I can have a child using my own eggs. It's so much easier to see these facts. But what about the coping? Because I know friends and others who've asked, well, how many cycles? How many cycles? And, should I do this diet before that to optimize my eggs? And, it's such a panic because it feels like this is it and everything about it has to be perfect. And again, obviously everyone's mindsets are different, but in a lot of the conversations I've had, that can sometimes be where people are at. So I guess what would you advise, either how to cope with that or tips of, like, if you do X, it's not going to help all that much. Just do these foundations and it will be fine, and just try your best to stay calm. Like, how would you help someone balance that dynamic?
Yeah, I think that what I tell patients, you really have no control over this. Your egg quality has to do with your age. You can't control that. Your genetics can't control it. The only thing you can really control is your environment. And so the best way to control your environment is through all the lifestyle things that people already know, like hydrating well, eating a well-balanced diet. And I always say, don't avoid food groups. Like, there's absolutely no reason to do that. When people start elimination diets, there's no evidence that that helps at all. There's no study that shows removing gluten from your diet, avoiding dairy, avoiding sugar improves your egg quality. There just isn't. But we know that well-balanced diets do. The Mediterranean diet, for example, sleeping well, getting really good quality sleep, reducing stress. I often focus on meditation and mantras with my patients and trying to find joy in each and every day and not allow this process of being a fertility patient rob you of your joy. And basically, I don't like it to see people spiral. I don't like it to see people become obsessive or turn
Right.
insane, because it can certainly make someone who doesn't have OCD, give them OCD, make someone who's sane feel insane.
Mhm.
And I think a lot of it has to do with some of the things that we see online that we feel shame for not doing. And then I tell people, please stop doing that.
Yep.
And I worry about all the temping, the tracking, the daily hormone checking, the cervical checks, the urine checks, the Ava bracelet, the thermometers. And I'm just like, just stop it, because none of that's going to make a difference. So just live your life, pee, flush the toilet, and enjoy your days, and realize that, you're going to do your very best by understanding what your numbers say, meeting with a doctor that has the same priorities as you, and then just move forward with a nice plan. And at the end of the day, I want you to sleep well.
Yeah, it's funny looking back. I wonder if my OBGYN didn't catch this,
Mm-hmm.
if I would have been more calm. I think it was the shock, and I could never calm down about it because it just was this ride of, like, this constant what the heck. So um I wish I'd come across you back then. So what about so here's a question that I often get is endometriosis. Now that is, and by the way, I had it, which, and I had the silent version, so to speak, which is why I think it took so long for people to figure out what was happening. But I, I've had friends when they hear about this, or just random people that will meet me, say, well, if I have endometriosis, do I get the surgery first and then do I freeze my eggs? Do I just, freeze my eggs and not worry about it? Do I get surgery now just in case it'll help me for late? Like, there's so many, like, I think the endo part really confuses people. So I'd love to get your perspective. And I know endo is so complicated.
Yeah.
So much needs to be understood, but it would be helpful just to know, based on what we know today, what your thoughts might be.
Yeah, I mean, it's pretty straightforward. You look at the person's age, you look at their AMH level, and you ask them what their priorities and goals are. So for some people, it's, I absolutely don't want to do IVF under any circumstances, then that's a different plan for them. If it's, yeah, I really want a lot of kids and, I'm open to all options and ways to get there, then, potentially, considering excision surgery before or after an IVF cycle could be helpful. So I'll just give you some scenarios. So let's say you have a low AMH level. My concern if you go into surgery, especially if you have an endometrioma, is removing healthy ovarian tissue. So what I would usually recommend in a case like that is do an IVF cycle first and see what happens. And then if you're not successful, then consider excision surgery soon after from a surgeon that is highly trained in excision, and then try another IVF cycle soon after. So that's, how I would approach things. If you're someone who's done a number of IVF cycles without success, then I would say, yeah, even if you have an endometrioma and your ovarian reserve is low, it might be worthwhile taking the risk and doing excision surgery. So I think it just kind of depends on your age, how many kids you want, and your hormone levels, and then that's how I decide what the best plan is for that patient.
Got it. And what about with egg freezing? Because I've had friends who are just freezing eggs and are wondering if they haven't had the surgery, if the inflammation and whatnot that the endometriosis has associated with it, could that impact the quality of the eggs and things like that? So do we know? And do you have
Mhm.
any thoughts on that?
Absolutely. So for women who have endometriosis, the egg maturity will be lower, and the physical characteristics in the eggs might actually, be a good guide. Like when the embryologist is looking at the eggs, they write notes down. There's something called a gamete sheet, and that can be shared with the patient. So I would share it with my patient and I would say, yeah, wow, your eggs carry we see a lot of the things that we would see in eggs that, may not be as good quality as we would expect for someone of your age. And so let's consider excision surgery and then do another egg retrieval. And it might make sense to also make embryos for you. Because I
Got
say it
it.
often that endometriosis robs women of healthy eggs. It causes our eggs to age faster, and it causes more genetic abnormalities in the eggs because of the inflammation. And so to protect yourself, you could do a cycle of egg freezing before excision, a cycle of egg freezing after, and then consider a cycle of embryos. I think women just aren't freezing enough. When people say egg freezing doesn't work, I say, well, it's because you didn't freeze enough eggs at an age that was young enough to give you the best chance. So the word is out, egg freezing works. It's just a matter of, have you frozen enough eggs for yourself, and did you do it at a young enough age?
So people want the number. I mean, how does one determine that number? And I know there's a lot of factors like
Oh yeah.
age, and like how many kids you want and things like that. But I remember when all this started, the number was, for every baby you want, you should freeze 10 eggs or so. I think that was the
Yeah.
equation. So is there still an equation for this?
There is. I mean, the thing is, though, it's hard because I can get 10 eggs for someone and get one healthy embryo. I can get, 3 eggs from someone and get 3 healthy embryos. So it doesn't, those rules, what we've learned is like, they're not, you can't rely on them. So I don't want anyone who, let's say, has 6 eggs frozen, feel like she hasn't frozen enough if she's kind of tapped out and she just doesn't want to do it again. Because she might. You just don't know until you actually, try with them. But let's just say, for example, if you're 37 years old, I'd want you to have 30 eggs frozen for yourself if you want 2 kids,
Got it. Okay.
you know?
That makes sense.
So I know that's a lot, but I just know what's happening right now in today's world is women are just waiting until they're in their mid 40s to use those eggs. And if you don't have enough eggs, you just, you might wish you had frozen more. And now's the perfect opportunity to do that.
Right. Now, you brought up AMH. So I've been seeing folks say AMH doesn't matter. People are putting too much weight into it. AMH is the thing you need to know. Nothing else matters. I've heard it all.
Yeah.
So where are we with AMH?
I think AMH is a very important test. It can help you do fertility planning for yourself. So, for example, if your AMH is zero point 0.3 and you're 32, you know you're going to go into menopause probably by the age of 40. And so you don't want to be that person that starts her family at 40. So I think that's important to know. right? And there's so many people that are showing up at 41 in my office saying, I'm ready to start my family. And if their AMH is 0.05, they would have been pissed that, no one told them about AMH. So I think AMH is still a useful tool. It doesn't tell me if your eggs are healthy or not. I would say if you're, let's say, 32 with an AMH that's, let's say, 0.3, that tells me I could probably get you about 3 eggs. And you might need 3 or 4 IVF cycles if you want, let's say, 3 or 4 kids, if you're planning on preserving your fertility for that purpose. So it helps me again with like fertility projections. So I can kind of give someone a plan based on their hormone levels. And it's not just the AMH, it's also the
Right.
FSH, it's their family history, it's their follicle count. And I put that all together for them and I like to pre-plan their fertility plan, and then they can, think about what feels right for them.
So based on the people that or the patients that you're seeing and working with your colleagues, just based on that whole dynamic of trying to help a woman or a family decide the best path forward, what do you say are big misses, or conversations you wish people would have more of around the dynamics of the hormone measurements and the diet and things like that? What are people not necessarily getting right that they should, which could potentially transform their
Mhm.
path forward?
Big misses is relying on one set of hormone levels and saying that defines you, not realizing that an AMH could be wrong or an AMH can change over time. So you can have someone who has an AMH of 3, they think they're perfect and they have awesome eggs. They repeat it a year later, it's 0.5. It turns out that that level of 3 was incorrect. So I think women who are in their 30s should probably repeat it within 6 months just to make sure that first level is accurate, and also do an ultrasound. So I think that's a huge miss. People miss out on the opportunity to see a fertility doctor and actually in person get an ultrasound done. And so I think there's an opportunity there. I think we didn't bring this up, but another huge miss around diet is PCOS patients is really not really what we're not doing is treating PCOS from diagnosis. We're telling patients still, which is really frustrating for me, that it's nothing that you need to worry about until you're ready to have a family. And by the time the
Yeah.
PCOS patient sees me, then we're playing catch up for like 15 years of, no periods, high testosterone, and that's just a really hard place to be in. So those are the two big misses that I see.
Okay. It's interesting because I'm curious. So my path was very different, right? I had an OBGYN who right away did testing and said, go to a fertility doctor. And, you see these stats. I mean, now again, with awareness, it's so transformed, where there's a lot of discussion around people not understanding male fertility is an important factor. And, um, again, like some of these underlying things that need to be sorted out. Are you seeing that it's more balanced where it's not just after so many years or months of trying and someone finally goes to a fertility clinic that it's like this wake up call of, holy cow, why didn't I know this a long time ago? Do you think it's more balanced, or are you still finding there's a gap between the OBGYN and then the reproductive endocrinologist? Like, what should
Yeah, I
people
mean,
be
OB.
prepared for?
Yeah, so I would say people think that they need a referral to a fertility doctor from their OB/GYN. You do not. Everyone can see a fertility doctor by just saying, I'm thinking about having a baby. I would say get your fertility checked from a fertility doctor, because they're going to be able to give you the most accurate advice, and they know what tools in their toolbox can be applied to your case. Your OB/GYN, they might have some bias and prejudice and might have some feelings that are not science based. Like I had a patient who was just told last week by her OB/GYN that the longer she waits to use her frozen embryos, the lower the likelihood of success from those embryos. And I was like, there's no freezer burn. You can use those embryos indefinitely. Like, what is she talking about? That's just scary to me that someone with a medical degree is giving such bad advice. And I'm just thinking about all the other things that she's probably saying to her patients. I have patients that are being told, oh, you're over 40, try for a year and then see a fertility doctor. And that's also like the worst thing that you can tell someone, or tell someone who just had a miscarriage, you need to go on birth control pills for a year to get your body ready for another pregnancy. I hear those things. And so I feel like if women went right to the source, like if you had a heart attack, you're not going to go to your family practice doctor when you're having your heart attack. You're going to go to the cardiologist. So every woman should feel like she has the right and ability to just self-refer and get the most accurate knowledge from the fertility doctor, not get, a fertility workup from an OBGYN. God bless them. There's so many amazing ones out there. And then you come bring your results to me and I'm like, they only did an FSH, they checked your HIV, and now I know your blood type. How is that a fertility workup? That still happens.
And, you know, I know that there are some great companies that are really working on helping women understand their hormones. And I know you mentioned some concerns around that. So for those who are simply relying on that, how should they, like, what I'm trying to figure out how to ask this question. Like, what's the boundary or the parameter in which that helps? And then people need to acknowledge there may be more support that's required. Like, how should one view those and put perspective on it?
Those tests are highly accurate. They are often even more accurate than going to a Quest or a LabCorp. And I think you're referring to those blot paper tests where you use a lancet, prick your
Mhm.
finger, and then put blood on a piece of paper.
That some of them you can
Um,
pee on too. So I guess that's also a very important thing to differentiate. So
the
it's
P tests don't look at AMH. I'm referring
right.
more to like an AMH level.
Okay.
So
Okay. Sorry. Let's
yeah,
clarify that.
no, you're totally fine. Um, so basically, what I tell people when it comes to the AMH test that you're doing from home, that those companies are they try and get people to repeat it. And I think there's even some subscriptions that you can get, so you're repeating it over time. And I feel like if you have a low level or a high level, repeat it within 3 or 6 months.
Okay. What about the ones that are measuring the other hormones who are um, trying to help people get pregnant or stay pregnant? Like even some of them are looking at the progesterone levels, and they're more the pee on the strips type of test. How
Hmm.
should women look at those? Because I mean, I do like that they're helping women have much more awareness, but to the point we had earlier, it could create stress and paranoia, but then also how accurate is it? So again, what
Yeah,
should we look at for those types of tests? How should
yeah,
we put
yeah. I
those
mean,
in our toolbox?
I want people to stop peeing on things. I mean, I just want people to flush their urine. And I actually had this idea. I'm like, what if you put like a sensor in the toilet that would measure your pee's hormone levels?
Oh,
And I was like, oh my God, brilliant idea, Amy. And then someone already has a patent on it and it's coming out soon. Literally, like a
fabulous.
urine hormone sensor you just put in your toilet. So every time you pee, I mean, isn't that insane?
I love
But
that.
until then, I think my favorite test that I tell patients about is the Prove Complete. So easy test to do: FSH estradiol at the start of your cycle, LH to predict your window of opportunity for ovulation, and then confirming ovulation with the PDG test, which is a progesterone metabolite in your urine. So that's an easy one to do. I mean, I know there are people that pee every single day, many times a day, and track their hormones, but I think that there are other things that you can do with your time than spending so much time in the toilet.
Right. I know the founder of Proof, Aimee Beckley. She's
Yeah,
amazing.
yeah,
When
she's
I
awesome.
remember when she first came out, and I called her right away when I was like, someone finally understands progesterone is important. I called her up and I was like, I saw this article. Can I please interview you? So she was actually one of my first interviewees, and I have been following her along the way. I think they're
And
now in
Georgie,
Walgreens.
yeah, I did the same thing. As soon as I saw like a Google alert, I saw some article, some like Colorado paper, and I
Yes.
immediately called her. I was like, "We're both named Amy. We need to be friends." So we actually, along those lines, we just actually launched the first of its kind program through Prove, powered by it's power. It's through Prove, but I'm the physician, and it's to prescribe progesterone to women, no matter where they live in the United States. So
Oh,
patients don't have to
fabulous.
feel stupid or be told no by their doctors.
Okay. Oh my God. I'm so happy to hear that because
Yeah,
I am shocked at how hard it is to get a prescription for something that is
yeah,
clearly going to help people.
I
So,
agree.
another question I have is about relationships and fertility treatments.
Hmm.
Um, I, and, you know, I know that towards the end, it was really hard because it was just so many years and so much stress. And um, I had called Dr. Braverman and he had shared there's a lot of that, but it was something no one ever talked about because for those who are open, it is, which doctor did you go to? How many cycles did you do? How many embryos did you freeze? What was the grade? Like those are your conversations, but it never goes to how's your relationship and how are you surviving? And because you are the clinician who sees all these dynamics, I'd love for you to share what really goes on behind the scenes in that kind of a dynamic, because I don't know if it's necessarily discussed as much.
I think we're discussing it more and more, and now there are support groups for men, which is also really helpful. And I find if I can approach things with, it's both being professional and serious, but also with humor, that hopefully that also rubs off on the families that I'm seeing, and so that they can find humor in a lot of the things. Like I just made a joke today. Someone told me that they collected their sperm in a Ziploc bag, and he said he felt like he was, and then something like, they felt like they were treated better at McDonald's than the clinic. And I made a joke and I said, well, at least at McDonald's, you got a lid for your cups. I mean, it's like, you just got to find the humor and stuff and just keep things as light as possible and just always communicate and realize that women take things differently than men, but it doesn't mean that men don't have all the feelings and don't feel shame and don't feel sad, because they certainly do. We have a lot of guys here that cry just like women cry. And so I recommend one-on-one therapy, each have a therapist, couples therapy, group therapy, and then finding another couple that can really that you can relate with, but not compete with as far as
Okay.
like what your numbers are.
Yeah, no, that makes sense. And then what about as far as I lost my train of thought. Oh my goodness, I can't believe that just happened.
Anal sex, not good. Does not help you get pregnant. I mean, I'm thinking maybe you thought of that, Georgie. I don't know.
Oh my God, you're so funny. Why can't I think of my question? Oh,
You
I know what
can't.
it is. Okay.
Yeah.
So part of why I had actually started this podcast is I was doing some research, and originally I was actually going to build a startup for fertility, and it was really going to be about around education, like what do you ask your doctor, and then having clinicians or nurse practitioners or whatnot just coaching people through. And this is obviously well before all of these wonderful resources, but it was a huge gap of like, why are we learning this along the way? Then I transformed to making my podcast about all women's health because of a Reddit post. And the Reddit post was, I am 42 and I have 2 embryos left. I constantly have miscarriages. Should I use 1 or 2 embryos? And it just, I'm like, she is asking the wrong question. And again, I'm not a doctor, so maybe I should or shouldn't have said this, but my instinct was, my dear, that is not the right question. Your question should be, why are you having miscarriages? Understand what's going on with your body, because these are the youngest embryos you are ever going to have. So the question is not 1 or 2. The question is when and if.
Right.
And it just hit me like there's this whole root cause that I feel like gets missed. And I don't
Hmm.
know if it's the women who, we as women who just want that baby and we just rush to get the IVF. Is it clinicians who may not be doing the due diligence? Is it a mix of a lot of things? And this is not a point fingers things, but I think it's complex is the point I'm trying to make. And so that's why I started doing this podcast on all women's health topics, because it's like we have to understand what's going on with us before we start doing all these things of more
Hmm.
medications and more
Hmm.
IVFs and anything else that we need to be healthy. So I guess I would love your perspective on the your I guess words of wisdom to people going through this and that whole understanding the root cause. Because I'd hate for people, especially in this quick fix society, to view this as I'm going to freeze eggs and then get an IVF, or I'm going to do an IVF, and they skip all the other stuff.
Right.
So, what are your thoughts?
Yeah, I mean, that's why I created all these cheesy mnemonics. I mean, that's where the Tushy method, balls method, and then I have an angel method. I have embryo diamonds. So, angel method is my workup for women who may have had a miscarriage or a family history of miscarriages. These are tests that you do for someone who has recurrent pregnancy loss, but I like to prevent recurrent pregnancy loss. So I call it a prevent recurrent pregnancy loss workup. So you're right. Anytime I have embryos, I'm always thinking, if this doesn't work or she miscarries, what testing would I do? What would I do differently? And then I'm going to present that to her and say, would you like to do this first? And I've had patients that say, Aimee, no, I'm fine. Like, I will accept. I don't want to do more tests. I'm kind of done. And I have other patients that are like, heck yeah, I'm so glad you're thinking like this. I'd like to do these tests first, because I would hate to transfer the last two embryos a woman has and then have her say, well, what should we do from here? And I give her the list. And then she's like, but I don't have any embryos left. Like, why would you offer that to me? Like, why would you offer to me a surrogate knowing I've done like 6 IVF cycles and now I have no embryos left? Like, now I have to, do something that I was hoping I didn't need to do, although it's a good option for a lot of people, and that's using an egg donor. But most people would choose their own DNA if given the option. So I'm totally
Right.
with you. It's about asking the questions. And then I always tell people, ask this very important question: what would you do for me if this transfer didn't work? What other treatments, what other tests would you offer me? I'm just curious. And then you can say, well, actually, thank you so much for bringing that up. I'd like to do those now.
Okay. That makes sense. No,
Yeah.
and I mean, you're clearly very, very thoughtful about this. I do feel like some of the places I had gone to was just this assembly line. I definitely felt that.
Hmm.
And I felt like I had to advocate a lot for myself. And so I'm so glad that you're putting these educational programs together. So we already know that you want the innovation of things. I'm hearing this theme from you, which is it's actually fairly simple. There's actually a process to all of this, and we shouldn't um, overcomplicate the things that don't need to be, such as the hormone measurements. If you could just pee in a toilet and get it measured, done. So we got
Right.
that taken care of. What else do you hope to see change when it comes to this world of family creation, especially as we are often choosing to have children later? And notice I'm not saying IVF and egg freezing, because it could be broader than that. And I don't want people to
Right.
think it's a straight shot to that. But what are
Yeah.
the innovations you hope to be able to see?
I mean, this is not so much an innovation, but I would hope to see that it's free and costs something that everyone could afford and done for everyone who wants a chance, even by the age of 25. So that would be an amazing dream of mine. The other innovation I'd love to see is a way for women to be able to preserve their fertility without freezing their eggs. So a new breakthrough
Mm.
drug, or, there's in vitro gametogenesis, there's rapamycin. So there are a lot of things that could be available to us in the future. But unfortunately, the way I think about it is, if Roe v. Wade got overturned, like, who would have thought that could have happened? The
Right,
likelihood that we as women are going to have some amazing breakthrough available to us that would be cost effective for women to not have to freeze their eggs. I don't see that happening with how politically things are going right now. So that's
right,
that's what makes me sad, is that we could have so many things that we could be doing to prevent miscarriage, better genetic testing for women, you know, um, stem cell research, maybe the use of CRISPR-Cas9. So these are all things that I think could help us, but I don't think I'm going to see them in my lifetime, unfortunately. I know other people say, Aimee, there's still a chance. Maybe in 5 years you can turn a skin cell into an egg cell. I'm like, I love how you're thinking, but I don't think that's true. But I would love for that to
right.
be a reality.
Do you feel that people are looking too much at how to optimize IVF, or maybe a better way to frame this is, do you feel like some of the research is directed and maybe not the best place to solve for the longer term issue? And so now I'll say what I was saying in the beginning, which is some have said to me, and I actually sometimes wonder this as well, is because the money can be made in fertility treatments, a lot of the money is spent on making those better rather than fully innovating in the space. Like, I would love to see more women's health research and understanding why our bodies are the way they are so we can get better and, like, for example, have treatments that are better than they are for endo, have people diagnosed earlier for PCOS and all that. But, I'm just so curious how you feel about where the effort truly is, given where the money is to be made.
I mean, I don't see that there is much effort in ways to Im- improve things, for us. I mean, I don't really see. I mean, I'm a very optimistic person, but when I look at what changes we've made in the last 15 years, there really haven't been any huge breakthroughs. I mean, we might be a little better at genetic testing, but we still can't see the entire genome of an embryo. You can still miss things and have babies with serious diseases, even though they did genetic screening. You know, my patients are still making, you know, embryos that aren't or that don't grow really well, and we don't know why. People are still having miscarriages of euploid embryos. We still don't know why. As far as like why this isn't, I mean, it's just incredibly expensive, and there's so much bureaucracy related to this kind of research. So, I mean, I think a lot of times this research is being done, you know, in animal models and then also in other countries. But I hope that some of these, and if you want to talk a little bit more about some of the innovations that I think are super exciting, you know, I think a lot of these clinical trials are being done in other countries, and hopefully we'll see the, you know, that technology then come here down the road.
Okay. No, that would definitely be exciting. Real quick, grading of the embryos.
Yeah.
What do people need to know about that? Because and again, when you've been on the journey a long time, it's like any 1/10 of 1% of hope is like the best thing ever. And so I'm
Yeah.
partly, you can see I have the passion for the people who are like really, really struggling, but I know we also wanted to cover the foundations today. But how should, again, because you have such a calm way of like fact based. So when people see the grading, how should one really take that into perspective?
First of all, grading matters. I know there are some doctors that say all your embryos, doesn't matter the grades, you have a 50% chance. That's totally incorrect. So that's why I came up embryo diamonds. So that each letter represents something, and everyone needs to know about each thing about their embryos. So people should know which embryos are normal. They should know what day the embryos were frozen on. Were they day 3, day 2, day 5, day 6, day 7, the implantation rate, which one's mosaic. They should get the official reports and make sure that mosaicism was actually screened for or unmasked, or if they were lied to and their embryos were actually mosaic and they were told that they were abnormal, you know, you get into situations where patients are discarding potentially healthy embryos. So for me, quality absolutely 100% matters, and people are not getting their reports back. People are going through several IVF cycles and never see a single embryology report. And when they ask the questions, sometimes they're heartbroken to find out that they were given false hope, that embryos were frozen that actually don't have a chance for pregnancy. And unfortunately, I still see that even today, where patients are told that they have, you know, 2 beautiful embryos, and when they get the quality back, they realize that the likelihood of them working is less than 5% because of the quality and how they were frozen. So I want people to, you know, make sure that after an IVF cycle, you do a post IVF consult with the fertility doctor immediately, not 3 months or 6 months later. And unfortunately, I see that happening where people are scheduled like 3 months out. And it's like mind blowing to like, it's baffling. It's like, how does that happen? Like, how can people go through such a big procedure and then not regroup right away when everything is top of mind? So I think that's an important thing for people to do is ask, what's the quality of each embryo? What embryo was it frozen? What's the implantation rate per embryo? And then these are my goals as far as how many kids do I want? How many more embryos do you think I need? How many more cycles should I do? I think you need to have those conversations up front, not after, you know, you deliver your first baby and then find out that the next 2 embryos actually had no chance. And now you're 43 years old. You know what I mean? Like those are the experiences I don't want people to have.
Right. Oh my goodness. I'm sold. Like if I were starting my fertility journey, I'd be like, I'm calling Dr. Aimee. I'm taking
Aw,
all of her
thank you,
courses. Like,
Georgie.
no, I mean it's true because you have such a calm demeanor, and it's again, I'm not saying that, you know, it's easy. I think even if, you know, even as people take your courses, I'm sure there's still that hope and that I can do anything, but just the way you speak and the frameworks that you're creating are so important in the chaos that and the fear, challenge, finances, everything that comes with all of this.
Mhm,
So I appreciate the work that you're doing. And I now see
mhm.
why my lovely mentor recommended that we connect because I wanted to get the latest and
Yeah.
greatest on IVF and simplify things for the journeys.
Mhm.
Um, so I really, really appreciate it. Any last words that you would like to share?
I mean, I think the most important thing that I want people to do is find a way to make their bodies feel alive every day. And I want to use the word vibrate. Like really feel joy, and not just like a little bit, like, connect with someone you love, like do something to make yourself feel alive each and every day. Because this process of being a fertility patient can be soul sucking, soul crushing. It can make you feel like a shell of who you once were. And I want you to take the trips, go to the parties, drink that glass of wine if that's what you want to do and choose to do, and don't feel shame about it. So I think that's like something that I've been kind of sharing more recently with people. And I hope people will hear that and listen to that song, blast that music, go on that walk, hug your partner, have sex again, and not at the time when you're ovulating.
Yeah, no, I mean, those are wise words. And as someone who went through this, I think they're the absolute right ones. But thank you for your passion and turning it into even more than treating your patients and being able to scale your wisdom so that others can access it as well. Because I know you can't treat every single human being on the planet. So,
I'm trying. I'm trying though. Okay.
well,
Thanks,
how would you
Georgie.
like people to stay in touch? And I'll put everything in the show notes too, so no one has to memorize it. But how would you like people to stay in touch?
Anywhere that you put in Egg Whisper, Google, you'll find me. I'm pretty easy to find. So you can find my website, draimee.org. You can go to iTunes, Spotify, wherever you listen to podcasts, put in the Egg Whisper show, YouTube as well. So I'm pretty easy to find on Instagram, for example. But the best way to connect with me, if you want me to hear your story and share my expert opinion, would be through the Schedule a Consult tab on my website. And then for people who don't quite feel like they want to be a patient, but want to get advice that's a little bit more personalized, so I would take one of my courses.
Okay, wonderful. Well, thank you so much. I really appreciate you making time. This was great,
Thank
really
you,
helpful.
Georgie. My pleasure. Anytime. Thank you so much.